Hello, everyone. Welcome to Behind the Research, a segment of PT Meal Podcast in partnership with the Philippine Journal of Physical Therapy, the official journal of the Philippine Physical Therapy Association. In this segment, we will take a deep dive into the research and talk to authors of select articles published in the PHJPT. So, in this episode, we will discuss the research entitled Occupational Safety and Health Practices Among Physical Therapists in Metro Manila during the COVID-19 pandemic, a qualitative study protocol. So I'm pleased to have in the show its principal author, Assistant Professor Zyra Mae Sicat, a faculty member in the College of Rehabilitation Sciences in the University of Santo Tomas. Welcome back to the podcast, Zyra.
Hi, sir. It's nice to be back.
All right. Nice to have you again here. And joining her, Richard Lemuel Budomo. Welcome to the podcast, Lem.
Thank you, sir. It's nice to be here.
I really appreciate you all being here at last. And we're going to talk about your research on occupational safety and health. So to give our audience, the viewers and our listeners, an idea of what we're going to talk about, could you give us a brief background on what your research is and what it's all about?
So the title of our study is Occupational Safety and Health Practices Among Physical Therapists in Metro Manila during the COVID-19 pandemic, a qualitative descriptive study. So this research is as the title says, it's a qualitative descriptive study. And with the study, we aim to understand the experiences of clinical physical therapists in Metro Manila during the COVID-19 pandemic, and also explore their occupational safety and health practices and their responses to occupational hazards.
So, could you give us an idea what occupational safety and health is first?
Sure, Sir Johan. Actually, occupational safety and health in general aims to promote the well-being of all workers, despite
Mm.
of the setting. So, regardless if it's healthcare or company-based setting, the main aim is to protect and promote the well-being of workers.
Yeah.
So, occupational safety and health deals with occupational hazards. These are things that can affect the health and well-being of the worker. So, for example of occupational hazards. So, going to the back to the previous study is COVID-19. Very recent COVID-19 or SARS-CoV-2. The causative agent is a biological hazard, and we all know the potential effect. So, you can get infected, you may not be infected, dependent on the controls in place. So, yung controls in place na yun, that would be the role of occupational safety and health.
Mm. So the experience of physical therapists in Manila during that time with regards to occupational safety and health, that's what you're uh, trying to find out in your research, right? So give us a context. Why did you pick this topic as a topic of interest for your research?
So we started drafting the idea for this research topic in the year 2021. So it was a little over a year after the COVID-19 pandemic started. And in this case, the healthcare facilities in the country started opening up again. They started running again. And in this case, we wanted to there are many policies, uh occupational safety and health policies being implemented by the government in different healthcare facilities in order to, handle and control the spread of the virus. And in this case, we wanted to see what the experiences of clinical PTs were in terms of, in terms of adjusting to these changes and to these policies, because as we all know, the OSH policies being implemented during that time was mainly focused on, social distancing, wearing of PPEs and many other stuff that would, practically get in the way of how physical therapy is conventionally delivered in a normal setting.
Mhm.
Because we all know that physical contact and manual therapy is very important in the practice of PT. And in this case, we wanted to see, their experiences with these changes.
Mhm. I see. I see. These policies were in the Philippine context were primarily coming from the Department of Health, right?
Yeah, both the
Yes,
Department of Health and also the Department of Labor and
and
Employment.
employment
Yeah,
Uh-huh. And OSH is under the Department of Labor, correct?
and
yeah.
employment. Yes, sir.
Employment. Okay. I see. So,
In addition to Sir Johan,
mm,
I had a previous study. It was a cross-sectional unpublished study, and surprisingly, majority of the rehabilitation centers are compliant with the OSH policy stated by Lemuel earlier. So that led us into thinking that what else is in store for physical therapists if they are compliant with the OSH standards? So the experience of the pandemic actually challenged the OSH policies and OSH standards of the country. So what was the experience of our fellow physical therapists because of that?
mhm. So in that unpublished study that you were referring to, physical therapists were compliant to the policies that OSH and Department of Health initiated. So, what are the practices or experiences that you were looking for in your research?
Okay. So actually the policies and the standards are basically a yes or no question.
Mm-hmm.
Do you implement this or do you implement that? But the experience or maybe the how you implement
Mm-hmm.
those policies and those standards will be a completely different thing. So that's why we actually want to know more about it through the experiences of our physical therapists.
Mm. So how they related that to their practice, those things might be
Yes.
unique for each setting and uh, each specialty. So I've read in your protocol that you included variety of settings in getting your participants, but but you only included physical therapists that are working in institutions.
Yes.
Uh, why is that again?
So we wanted to focus more on, the clinical setting because there are many other settings in which PTs can work in. So this includes the academe,
Uh,
and research and many other things such as like they could focus on community-based rehabilitation. But in this case, we wanted to focus more on their experiences within healthcare facilities. So this could include both private and public healthcare facilities because we wanted to look at how they experience the OSH protocols being implemented by the government and also by these private institutions because the other professions outside of that would, they're not really under the OSH protocols being implemented by, as we said, DOLE and DOH.
mhm. They might be doing something else in their
Yeah, yeah.
practice. Oh, okay. Um, Talking about the physical therapy practice in general in the Philippine context, what aspects of the practice is somewhat covered by OSH standards or policies?
Can you clarify on the question again, sir?
I'm coming from my experience, wherein um in the US there are seminars that we attend or videos that we watch to comply with OSH requirements in terms of chemical hazards, injury prevention, and what else, and stuff like that. Is it basically the same as to what the OSH requirements in the Philippines in physical therapy practices as well?
Not just specific to physical therapy
Mm-hmm.
practice, but here in the Philippines, all um, all institutions, regardless if what area or what specialization is it, mining or whatever, they are under, of course, the occupational safety and health, and they have to follow it.
Mm-hmm.
So there are auditors, external auditors coming from the Department of Labor and Employment who checks or who
Mm-hmm.
inspects every institution. Specific to the healthcare setup, each institution has their own. So they have their infection control committees. There are other hospitals who has a specific department for occupational safety and health. But we have policies. We have actually there's a law on occupational safety and health. But the main question is how is it being implemented in every institution? The Department of Labor and Employment helps institution to
Mm-hmm.
actually implement us. They do not reprimand or they do not reprimand institutions who are not following, but they inform you, oh, you lack this component of
Mm-hmm.
occupational safety and health. And in other institutions, all employees are required to take a 8-hour training of occupational safety and health. So I think recent lang naman yun. That's very recent. No?
Mm-hmm.
But I think that's a good start, especially here in the country.
Right. When I was working in the Philippines, it, worked there for 7 years. I don't remember undergoing any seminar or attend or watch a video on chemical hazards, infection control. Uh, I remember there was we had before um, a meeting regarding JCO accreditation and stuff like that, but it's mostly about hand washing, infection control, and stuff like that, not the other stuff like injury prevention and others. So it's interesting that we're starting to be more aware and more um, I don't know, diligent in the OSH component of physical therapy when we are, as you mentioned in your research, that we're more vulnerable because we're, you know, in the vicinity of the patient, physical contact and stuff. You've already gathered some data, and could you describe to us in general, not to go into specific, um, how was the practices of physical therapists in Metro Manila during the COVID? Was there anything that stood out, or was it as you've expected it?
Yeah, actually, there were very many similarities also among the healthcare facilities in terms of how they responded to the pandemic, but at the same time, there are also some differences in terms of how they implemented it and in terms of the fine details of their policies. But, generally, many of the facilities included changes in terms of their work schedule, where they had to split their manpower because they wanted to limit the number of, PTs going into the clinic and the number of people going into the clinic every day. So this also included, the number of patients they would have each day. And in this case, since just because there was a pandemic doesn't necessarily mean that the number of patients who needed physical therapy treatment decreased. So many clinics, their response to this was they started implementing telerehabilitation. They started using technology more so that they could still continue their treatment, but at the same time, they limit the number of people, that are going to the clinics. They limit the possible spread of infections and many other stuff. And aside from that, there's also, well, as we all know, the wearing of, PPEs or personal protective equipments. They started wearing the bunny suits and they started being more strict with hand sanitation, um, and many other stuff actually.
Mhm.
So I think those are all I can say off the top of my head.
Uh-huh.
But there are many other things that they started implementing and many other similarities
Mhm.
with
And my
their own practices. Oh yeah, sorry,
and
go
my
ahead.
sorry. And my part, sir, one major thing that struck me the most about this study is that the exposure of physical therapists to us. A
Mhm.
lot of physical therapists has been was given a chance to to undergo training, and they are already certified safety officers of their respective divisions or
Wow.
institutions, and that also led to them implementing and drafting their own policies inside the rehabilitation center. That is really something very unique as compared to the practice before the pandemic. I believe you will agree with me with that. And then second, I think would be how the physical therapists develop the behavior. Maybe 2 years into the pandemic allowed them to develop those behavior like hand washing and changing of PPEs, changing of linens, and being more aware of the situation. And I am hoping that this behavior, these policies would eventually continue even after the pandemic because COVID-19 is not the sole occupational hazard in our industry.
Mhm. Right. Uh,
Actually, one other thing is it kind of showed how accommodating some facilities can be towards like their workers. Because a lot of the PTs we asked, or a lot of the participants we got the chance to interview, they would say that they got a lot of benefits also from their facilities. Like some of them would provide housing for their employees so that they could, they won't have to travel far. They won't have to risk themselves getting infections from, the commute from going home, going to work, stuff like that. So they got the chance to live in a place that's way closer to their workplace so that they could walk instead of having to commute and having to, be in contact with a lot of people.
mhm. So the pandemic showed us a different way of how we practice physical therapy in the Philippines, and showed us that there are things that can be improved, and
Yeah.
There are things that could run a different way.
Yes, definitely, sir. I had an opportunity to observe one center, and knowing that I also had an opportunity to be exposed to that center, I noticed a major difference in terms of how physical therapists handle their patients, how they sanitize all the areas just to ensure that there will be no transmission in the workplace.
Mhm,
So that's a great, I think, improvement in terms of our practice.
mhm. I'm trying when you were talking about like sanitation and infection control. I was trying to remember if if I changed linens after patients when I was working in the Philippines. I'm trying to remember those things. If that happened, or did
That
I,
never happened.
or did I just just wipe things with with a disinfectant? I don't remember that.
I think
Do
you
you
have
remember?
no experience. I have no experience, honestly speaking, sir.
It's hard to remember because that's something that would stick
Yeah.
with you if you'd practiced that before.
But
Yes, and
now, actually, oh, sorry, go
go
ahead.
Go
go
ahead.
ahead, them.
Oh, because, based on our experience, we just had our internship. Actually, we just graduated.
Mm-hmm.
So we just ended our internship year. So we got to, we got the chance to work in clinics during
Mm-hmm.
the pandemic, actually. I mean, technically now we're already transitioning from the pandemic to, the new normal.
Right.
But based on our experience, they're definitely, based on what you said, they're definitely a lot more strict now in terms of these infection controls. Like they really want us to change the linens. They really want us to wipe down the plinths we use and the equipments we use because, right now we're still implementing these policies, even though we're already transitioning, back to normal.
Mm-hmm.
There's still the chance that, our patients could still get infected and we still want to protect them in those ways.
Mm-hmm.
And the other side, those extra tasks may actually add up to the treatment hours or to your preparation time for each patient. But we always have to look back. Why are we doing it? We are doing it because we want ourselves to be protected, we want our patients to be protected, and mostly we want our families to also be protected because we always go home to our families and we don't want any hazards we got in the workplace to also infect our family.
Right. And going back to memory lane, now I remember we usually replace linen after the day.
Yes. And then
And
we hang our towels at the
mhm,
end of the day and reuse it the following day. And that's not the practice today, sir.
which
That
was,
has improved a lot. That has
Yeah, we
looking
definitely
back,
feature towels every day.
looking back, we should have done that before. We should have
yes.
changed linens after every patient.
Every patient, we should have soiled the towel per patient, even
Right.
the gowns.
Right. Oh my. Well, at
And back
least.
then, there were, I think, more severe virus or bacteria in the workplace.
Mm-hmm.
As we all know, COVID-19 is not just is not the most severe
Right.
virus.
Oh
Yeah,
wow.
but at least now we're starting to get better at it.
Yes, moving forward.
Yeah,
That's interesting. At least now we're more aware. We know what to do. What's the best practice now, and
yeah, definitely.
we can, as physical therapists, share that with our institution. And you mentioned that one of the good thing that happened here is that physical therapists get to be OSH officers,
Safety officers,
safety
yes.
officers.
There are institutions who
Uh-huh.
gave training to the physical therapist since
Mhm,
as compared to other members of the healthcare field, of
mhm,
course there are lesser risk involved in PTs, and of course since majority of the institutions are on an outpatient basis, so people won't be coming in, but what they did was to utilize the manpower of the rehab team and expose them to us and then
mhm.
implement. Some of them became safety officers, some of them were trained to swab
Oh, okay.
um,
Oh, wow.
swab patients. So I think that allowed us to explore other aspects of our profession.
Mm-hmm.
That what else can we do?
Uh-huh.
In other countries, also is being practiced by physical therapists. In fact,
Right.
we have the International Federation of Physical Therapists working for occupational health and in ergonomics, and it has long been practiced. It's about time to practice OSH in the country,
Mm-hmm.
especially in our field.
Mm-hmm. Uh, 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 another question regarding that. Um, what do you think is a physical therapist skill that is best suited to be an OSH safety officer?
That's a good question.
Mhm.
Lem, would you like to answer?
For me, I think being a safety officer, you need, some of the soft skills also, and some of the hard skills, which definitely should include being able to, you know how to lead and being able to know how to show initiative. Because a lot of the things we notice from, our participants. Sorry if I could talk a bit about, our findings in the study. A lot of our participants who got the chance to, volunteer as safety officers or OSH officers,
Mhm.
they really show that they could show initiative and they could show the initiative in terms of like researching, in terms of learning more about what else can they do, what else can they implement in their clinics.
Mhm.
So these things are important because safety officers in each facility should really learn to be proactive. They need to learn how to, always be on the move, always learn
Mhm.
how we can keep our employees safe, how we can keep everyone safe, including our patients, and also, of course, the staff because a lot of the employees would have to rely on these safety officers because they're the ones who are responsible and they have, you know, the obligation to implement these practices. And without those practices, without those policies, their health could be at stake also.
As I think in my opinion, Sri, as an OSH, as someone practicing in the OSH field and
Mhm.
also a physical therapist, our attention to detail is very important. We PTs are taught on how to really focus and to look for, like for example, our postural assessment. We check what ano ba nangyayari sa patient and all, and our we were trained to actually screen our patient. But this time, let us try to look at the environment.
Mhm.
We are not just focused on the human being, but on the environment affecting the human being. So
Mhm.
I hope our skill in terms of investigation,
Mhm.
our critical thinking skills will actually help us see the environment, and that will be very helpful in terms of occupational safety and health. You don't just focus on the on your patient or
Mhm.
on your client, but you focus also on the environment affecting your patient or your client. So that is us.
Oh, that's good. Yeah, we since we've already been like exposed to um the isip ko. So we've been exposed to physical therapists, we know the ICF model that included environmental factors.
Task
That's
the environment.
yeah, and then that's already embedded in us. It's not too far off to considering other factors outside of that, which
Mhm.
is as you mentioned, the environment. So right, yeah.
So
So
in terms of us, a lot of people would think that PTs are just for the ergonomic hazards because we
mhm,
are really trained for ergonomic hazards. But aside from ergonomic hazards, biological, chemical, and physical hazards also exist that we can actually control
mhm,
using our own critical thinking skills as
mhm,
physical therapists.
right. Then we can also like ask patients like, do they have molds in their houses, stuff
And how
like
would it,
that.
yeah.
How they're
Yes, and can
living.
provide a recommendation, provided that we have our own background and we read on it.
Right, right. Okay, so I'm really excited to read about your data and your findings here once you've published your research. It's really interesting to know what the practices now in physical therapy practice in the Philippines in terms of occupational safety and health, having practiced there a long time ago, and being comparing how we practice there in another country. So it's really exciting to know what changes happened during those years. At the same time, what changes happened specifically in COVID-19 during the pandemic. All right. So aside from providing a groundwork on OSH practices in the Philippines, what else do you think um, uh, would uh, or how the study would impact our profession and our practice in the Philippines as a physical therapist?
Actually, yeah, so that's a good point you mentioned, about contributing to the body of knowledge or the OSH
Mhm.
practices in the country. Because when we did our our literature research, actually we noticed that there were very limited studies that documented the experiences of Filipinos at that time. And that was already after, a little over a year
Mm-hmm.
since the pandemic started. And there were still very limited researches being done on, the experiences in the pandemic, the experiences of PTs in the pandemic. So we also wanted to raise more awareness regarding this concern.
Mm-hmm.
And in this case, raising awareness, hopefully what we want to happen is that these researchers that, hopefully other researchers would also follow the research we started so that, in the future, all these body of knowledge could be used to, formulate better guidelines in terms of handling infectious diseases, even in the future. So it's not really limited just to the COVID-19, just to the SARS-CoV virus, but this could also be applied to like other future diseases that could also be similarly like airborne and similar, modes of transmission to
Mm-hmm.
the virus we're facing right now. So I think that's one of the helpful things and one of the, what we really aim for in terms of making this study.
Mm-hmm. So you weren't able to see any like baseline studies on OSH practices in
Yeah,
physical therapy profession. Oh, so weird.
None. None, sir.
none.
None, sir.
At least at the
But,
time when we did our literature research.
Mm-hmm.
But
but
I
maybe
think
now.
now, yeah, there might be more studies now.
Uh-huh.
Mm,
I mean, but that's so weird that we physical therapy has been in the Philippines for more than 50 years, right?
mm.
Yeah.
And there was no study yet on any like baseline or whatever practice that we had. It's so strange.
Yeah, I
Okay.
guess it also reflects like the status of the profession in the country right now. I mean, considering, if you also consider like the other factors such as like the minimum wage of PTs in the country, if you compare it to, other countries, like stuff like that. So it really like shows how much attention is being given to the profession in this country as compared to other countries,
Right.
though it may be sad.
Uh,
So I think we have built a researcher and an advocate in this discussion, sir. Johan.
right. So probably with Lem will be reading more study on occupational safety and health.
Yes, but
Well,
on
that's
my
all
part,
thanks to Ma'am
I
Zai. It's all thanks to Ma'am Zai that I got more aware also about these
Mhm.
things.
well, as a researcher, I think that would be our realization too, that we can also learn from our participants,
Mhm.
that we are not just there to actually conduct the study, but actually learn from from their experiences. As for me, aside from the research aspect that Lem has mentioned, I also believe that I hope the behavior that was developed by physical therapists, by rehabilitation centers, the policies that were implemented, I hope they can continue. Again,
Mhm.
as mentioned by Lem, SARS-CoV-2 is not the sole occupational hazard in the
Mhm.
rehabilitation center. There are a lot. In fact, in fact, musculoskeletal conditions among physical therapists is the most prevalent work-related disorder for physical therapists. And we are not addressing it, despite the fact that we are capable of addressing it.
Right.
So I think the best way is to go back to occupational safety and health and also protect ourselves.
Mhm.
We cannot treat other people, we cannot make other people well without protecting ourselves.
Mhm.
Like,
Right.
paano naman tayo?
Right.
Ganun.
So this question is beyond the research now, but what do you think is, are the reason why there is not much of an attention on occupational safety and health in the physical therapy practice? Is it because in general in the Philippines there's not much attention on that in the healthcare setting?
Well, and if you will allow me to answer it,
Mm-hmm.
I think if we look at it among other members of the healthcare field,
Mm-hmm.
our risk is, if we classify it, maybe
Mm-hmm.
it's low as compared to the other members of the healthcare field,
Mm-hmm.
but it doesn't mean that we should be neglected, because
Mm-hmm.
there are still risks in our workplace. I'm not saying that we are how what yung term ulit, sir? I'm not saying that physical therapists are neglected in terms of us, but
Mm-hmm.
I think um, what is far more important, that we do ourselves more on self-realization, that we also have to practice it. Sometimes, going back to our research, there are physical therapists that do not follow the policies,
Mm-hmm.
despite
Oh.
being implemented, and despite the threat. So if there are people who will not follow
Mhm.
these practices, it will just go on to waste. So we always have to start within ourselves, and then eventually it will develop into something bigger.
Mm. So you think it's should come from the physical therapist influencing the administration, the center, or should it be coming from the center going down to the physical therapist?
I think it should be a collaboration, sir.
Yeah.
It's not just for physical therapists, but also for the employer part. They
Mhm.
have their responsibilities. It's mandated by the law.
Right.
I believe that each employer will do their part because it's mandated
Mhm.
by the government. However, as physical therapists, we also have to ask ourselves, what are we doing? Are we complying or not?
Mm. Mhm.
Yeah. I think collaboration is a good, a good solution and a good word for it because there are also like other factors that could affect their compliance
Mhm.
to OSH practices actually, as we found also in the study. Aside from just the benefits that they would receive from these OSH practices, that the safety that would, be guaranteed for them, that they won't be infected by the virus. Other factors also influence like how they comply to these OSH practices. So this also includes like the comfortability, the convenience of these practices. So a
Mhm.
lot of them actually also complain, though they show that they know, like they're aware
Mhm.
that wearing of PPEs, for example, is really for their health and for their safety, as well as for their patients.
Mhm.
But they also express their, some of their challenges that they experience in wearing these PPEs.
Mhm.
Because, yeah, as we know, being PTs and really needing our hands, like using our hands in terms of doing manual therapy, it's it becomes very difficult when you're, trying to do that with a lot of layers of clothes on, a lot of layers of protective equipment.
Mhm.
So a lot of them, with those challenges, they kind of stray away a bit from these OSH practices. So there are many things to consider. So I think it's important also to collaborate on these things and for the administrative people and the employees, the staff, to kind of like make both ends meet to decide on what the best OSH practices and policies they could implement would be.
Right. There's for sure there would be reluctance, there would be resistance,
Yeah, yeah,
and um, probably if the employer would make it more easy for physical therapists to comply, then you'll get more compliant
Yes,
employees.
you'll reap the benefits eventually.
Hmm. Yeah. But then again, on the employer side, you're gonna think about cost and you know
Yes,
sourcing.
yeah.
initially it will really cost. Like for example, you have to protect your workers, you have to give them PPEs, for example, the
Mhm.
appropriate PPEs.
Mhm.
But you also have to think of the longer term.
Right.
Usually, occupational diseases and work-related disorders, they actually increase the medical cost of the employee.
Mm.
They also affect the employee morale. So the transition and all will be greatly affected. If the workers are feel protected and they feel that they are loved by the employer, I think they will stay. And if they feel that there are no threats to their own health and to their family, they will stay.
Mhm.
So you just have to weigh in.
Mhm. That's another good topic to look into for in the Philippine context.
Yes.
Because there's a lot of like studies here on job satisfaction in relation to attrition to um workers compensation and stuff like that, so that's an interesting topic to read about in the
That's another
Philippines
topic.
context. Yeah. Okay. So thank you very much, Zyra and Lem, for coming to the podcast and talking about your research. We're going to look forward to reading about your results. This is really an interesting topic to get to know. So yeah, so for everyone who's interested in reading more about this protocol, you can go into the website of the Philippine Journal of Physical Therapy and look at Volume 2, Issue 2. The topic of their research, the title of the research is Occupational Safety in Health Practices Among Physical Therapists in Metro Manila During the COVID-19 Pandemic, a Qualitative Study Protocol. So until next time, stay curious and keep exploring the fascinating world of research with us on Behind Research. See you again, everyone. Thank you.
Bye. Thank you. Thank you, Yo. Thank you,
Thank
Lam.
you for having us here.